8:14 and a half. It is important to take your medications on time and as prescribed. That's a lot easier said than done. Dr. Brent Wallis joins us now, Chief Medical Officer of People's Health, Dr. B, to share tips for keeping up with your medication routine. How you doing, Doc?
Hey, Tommy, I'm doing great. How are you?
I am awesome. Tell me what it means to take medication as prescribed.
Yeah, sure. So just like it sounds, it really just means taking the medicine that your doctor gave you exactly how they tell you to take it and how it's written on the bottle. And we actually call that medication adherence, and it's really, really critical to taking care of your diseases.
Yeah, there's nothing worse than going to the doctor and he asks you and you tell him, because I've been there, oh, I was supposed to take it twice a day? I didn't know, right? Tell me why it's important to take your medication correctly.
Yeah, I mean, it's really critical to treating all of those illnesses and chronic diseases you have. And you know, really crazy, but about 1 in 5 new prescriptions that are written by a provider are never even filled by patients. And a lot of those new prescriptions that are filled are taken incorrectly. And that can, like I said, have really severe consequences. It can even cause something like hospitalization or a decline in your overall health and make those long-term health conditions like diabetes and high blood pressure even worse.
And to be clear, this is not something that just applies to elderly people. There's people of all age groups, right?
Yeah, exactly. Across the board, this is critical.
Give me some examples of taking medication incorrectly. I've already given you one, my own personal experience.
Yeah, we hear all kinds of things, but, you know, for an example, like you were saying, if a doctor says take 1 pill twice a day, that's a very common prescription that we may write. Usually we'll put on the bottle once in the morning and once at night, just to be clear. But some people will say, well, I'm just going to take 1 pill. I don't really think I need 2 daily. You know, they may take both of those pills in the morning because maybe they're worried that they're not going to take the second one at night. Some people will just skip their medications altogether. They may forget about it or they may feel like they don't need it. And then a lot of people will sometimes just stop their medications and not speak to their doctor about it, and that's something you definitely shouldn't do.
One thing I love is going to the pharmacy and it says take 1 pill twice a day, and I ask them, how can I take the same pill twice? And then security,
2 different pills.
Security usually escorts me out. Let's talk about some reasons why people don't take medication as prescribed. If people are out there listening and they're thinking, I feel fine, I don't need to take any medication.
Yeah, this is very common. We hear this all the time, but, you know, what I always tell people is maybe the reason you're feeling fine is because you are taking your medication. That's what it's intended to do, and it probably means that the medication is working, so you need to continue it to have that benefit.
Been there, done that. I don't need this. Then it comes back. It's like, well, yeah, it went away because that's why you're taking the medicine, dummy. I don't take any and somebody's out there thinking I don't take my medication because of the side effects.
Yeah, and side effects are very real, and they can sometimes be really severe. So you want to make sure you tell your doctor about any side effects you're having, because we can actually help you manage those. We can maybe adjust the dosage or change the medication to something different. You don't want to just change the medication, though, because we've got a lot of options, and we may be able to find something that'll work just as well for you, but without those side effects that you may be having.
You know, this next one, somebody... A doctor yesterday was telling me that we needed to get the word out on this about medications being too expensive to fill and some of the options that might be available.
Yeah, this is a growing problem. I mean, year over year, everything is getting more expensive, and medicines certainly are. And, you know, what you need to do in this case is definitely talk to your doctor. Sometimes physicians don't realize how much your copay or the cost of the drug is going to be. So if you get to the pharmacy and they say, I need a couple of $100s, call your doctor back. There may be cheaper alternatives to that medication. In particular, if you're taking a brand name drug, there are a lot of generics available that work just as well as the brand medication. And sometimes we can actually change the regimen that you're doing or maybe simplify it. And then if you're Medicare eligible, make sure you talk to your doctor about something called Extra Help. It's a government program through Social Security that can actually help you pay your copays. And you can find information at the Social Security Administration, but your doctor probably has flyers on it as well.
All right, let me take a break. We'll open the Oakwinard Jeweler Talk and Text lines, 504-260-1870. If you have a reason why you don't take your medication, text it in, and I'll let Dr. B address it. Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. We're talking about the importance of taking medications on time and as prescribed, which is, of course, easier said than done. And again, calling up myself out, I've already been to the doctor where it's like, we taking these twice a day, right? Oh, wait, I was supposed to take them twice a day? I didn't know. Well, maybe you should have read the bottle, dummy. That's what I said to myself. 8:20, traffic now, WWL. All right, 8:24, Tommy Tucker, WWL, back with our friend Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health. We're talking about why do you have so much trouble adhering to your medication, or why is it so tough to take your medication on time? Why is it so important? Somebody texted in, Doc, says they don't understand how to take the medication they were given.
Yeah, I mean, that's pretty common, and you shouldn't be embarrassed about it. These drug regimens can be confusing, so, don't hesitate to talk to your doctor's office or even ask your pharmacist for tips on how you can take your medications. And especially some people are on 4, 5, 6, or even more medications, and it can be really hard to figure out when you can take all of them. So ask for written instructions. It'll kind of help you with a timeline to know when to take them and how to take them.
Well, one thing I would suggest is maybe getting a whiteboard. That's what I have, and if I take what I'm supposed to take, then I check it off, and I know it's done for the day, and then just erase the check mark at the end of the day and start all over.
Yeah, that's a great way to do it.
Well, thank you, Doc. I came up with that myself. Somebody else texted and said I have a hard time getting to the pharmacy.
Yeah, luckily there are options for that. Sometimes if you can't make it to the pharmacy, it may be good to use mail order or even a pharmacy delivery service. A lot of local pharmacies will offer delivery. They'll actually ship it or bring it straight to your house so you don't have to go to the pharmacy and wait in line. And then the other thing I always tell people, once you're on a stable dose of medicine, ask your doctor about a long-term supply, because getting something every month is a lot harder than maybe getting it every 90 days. A lot less work to do that.
Somebody texted in and said, I've been taking the same medicine for years, but I got it refilled recently and it looks different, so I'm afraid to take it.
Yeah, this happens every once in a while, and what it is there's a lot of medications made by multiple different drug companies, and it's the same exact ingredient in the pills, but they may change the size or the shape or the color of the pill, and that can be very confusing. So if you get your prescription and it looks different, just ask your pharmacist why it looks different. Make sure they confirm that you got the right thing. But that does happen every once in a while.
So I've shared my advice with the whiteboard. Maybe you can share some tips for sticking to a medication routine, Doc?
Yeah, it can be tough, but there are a couple of things you can do. One of the things is make sure your medications are visible. If they're out of sight, you're probably going to forget to take them. And so maybe put them on your nightstand or in the bathroom so that when you see them, you can actually, grab the pill and take it. And then pill boxes are very convenient. That can actually help. They can have daily compartments. There are even some real big ones that have compartments for morning, lunch, and dinner. And you put all your doses in there, and you'll remember to take them, because if there's still pills in the box, you didn't take it. And then a medication calendar, kind of similar to what you were saying with a whiteboard, you can do that digitally now too. So everybody's got a phone. Put little reminders. There are even apps that you can set up that will remind you which medicine to take when. So that can be very helpful.
Yeah, I'm a whiteboard kind of guy, Doc. I'll stick with the whiteboard.
Pen and paper, I know.
Somebody texted in about habit stacking. What is that?
Yeah, so habit stacking is a really good technique, and what that is you're taking your medication should become a habit, and what you do is stack it with another habit, something that you do daily. So an example would be, everybody hopefully is brushing their teeth at least once a day, hopefully twice. So if you combine your medication with when you brush your teeth, it'll reinforce it and make sure you're taking that medication. Another one a lot of people do is morning coffee. If you get up and drink a cup of coffee like I do, have your pills right next to the coffee maker, take the pill at that time. And then I had mentioned, setting those cell phone or watch reminders. That can really be helpful too, because that little ringtone is something that will trigger you to say, hey, I need to take my medications.
Any final advice?
Yeah, the other thing is pharmacies usually have reminder programs. I know for me, they will call me multiple times over and over or text me or email me, but that actually is really good to remind you to refill your medications. And you may even want to do an auto refill program, which is where they'll go ahead and refill it for you and then just notify you that, that the refill is ready to pick up. But make sure if you're having trouble, talk to your doctor or even your pharmacist about it. We can really give you a lot of good advice.
Doctor, I got to share this with you before we go. Somebody texted in and said, reminds me of the Three Stooges episode where Shemp was given a prescription and the directions were take one pill, skip an hour, then take another pill. Mo gave him the first pill, then forced him to physically skip around for an hour and then take the next one, and Shemp was so exhausted. Sometimes things can be misunderstood.
Yeah, people can be quite literal.
I thought you'd get a kick out of that. Thank you, Dr. B. I appreciate it. Have a good weekend.
Thanks, Tommy. You too.
All right, if y'all want to know more about People's Health, it's pretty easy. You can visit the People's Health Medicare Center in Metairie at 3017 Vets. It's between North Causeway Boulevard. We were talking about Trader Joe's earlier. That's where it is. You can't miss it. Appointments are recommended, but walk-ins are also welcome. You can also go to peopleshealth.com or just call them at 1-800-978-9765. Peopleshealth.com, 1-800-978-9765, or visit the People's Health Medicare Center, 3017 Vets, between North Causeway and Trader Joe's. It's a beautiful facility. We'll take a break. We come back. We're talking about the Downtown Development District and what's going on there. Right now, we pause for WWL First News. For that, we go to our news director, Dave Cohen.